throughout this meeting, folks have, throughout these town halls I've had, I've said, man, are you fearful that something will happen in your town hall as happened elsewhere? And I've always said no, because frankly, I'm on the right side of the issues. And secondly, people in Louisiana are good people. And so we care about our country. And so it was as much a compliment to you as it was as to where I was on the issues. That said, let's talk. You know that you need better highways and roads. This parish, 80%, Mike Grimmer taught me when we first met that 80% of the people are on the freeway or some road going east at 8 o'clock in the morning. And that your economic development as well as your quality of life depends upon having a better infrastructure. So, and I just remember Grimmer telling me that. And I've had similar conversations with other people across our district. That said, highway capacity is not kept up with the demand. You know that as well as anybody. So one of my first priorities in D.C. has been to try and secure more highway money. Your local delegation, led by your elected officials, has been working to get state money to bring that I-12 widening as far east as possible. I made that my number one road priority, and so it's going to take lots of little pots of money, I think, to successfully complete that widening. Having said that, I wanted to first commit to you and tell you that that's our number one priority in our delegation up in D.C., and we're working to contribute federal dollars. Now, frankly, I think the state wants to keep the two apart because federal dollars introduce some more complications. So they'll take it as far east as they can with the state dollars and then maybe add a little bit more at the federal dollars. It won't be any single pot of money that completes it, but all of them put together will hopefully do so. And then after we do that, we'll start working on other projects, but I just wanted you to know that. I've spoke personally with John Boehner, who is the ranking Republican in the House of Representatives, and John Micah, who's the head of that committee, trying to get extra dollars for this parish for that project. Next, I've also learned coming over here, y'all got some Army Corps of Engineer issues. And again, that was a second thing I learned when I began to tour Livingston Parish. And so we had a meeting last week with Army Corps of Engineers. They took me around to, among other places, the Comeat diversion. Some of your tax dollars are going for that Comeat diversion, and it's a big project. And it's got a long ways to go. That's a water project, not a road project, but again, there's going to be federal dollars as well as state dollars that go to that mix. And so just to say that I know that's a concern. We have a follow-up meeting set up with the Corps in September, and I've asked them to bring me the information on your Juban Road crossing project, the permitting process. And so that's also something that is part of my conversation with the Army Corps of Engineers. How do we make life better for the folks in Livingston Parish? You are an economic engine for our state, and so we've got to make it so that you can develop in a safe way, an environmentally friendly way, and in a way which just contributes to this continuing its role as a economic leader in this area and in our whole state. Next, cap and trade. That's been a big issue. Oh, yeah, oh gosh, exactly. It should be a big issue. Cap and trade, as everybody here knows, attempts to put a tax on those industries that create carbon, and it would allow them to trade. Now, it's nice in concept, but the way they put it together is not very good. It'll have minimal impact upon the environment, but a big impact upon jobs. The Brookings Institute, which is kind of left of center, says that there will be a 40% decrease in employment in the petrochemical industry if cap and trade passes. That's a 40% decrease in employment at ExxonMobil potentially, 40% decrease down in Geismar, 40% decrease over in Dow and all those jobs. Now, as it turns out, my family moved here in 1957, not because my dad worked in petrochemical, but because he sold life insurance to the people that worked in petrochemical. And I am very aware that there's lots of jobs that are not directly connected, but one step away, whether you're selling cars, groceries, insurance, you name it. So when I say to people that cap and trade is a tax on tax on jobs, threatening to wreck the economy of states like ours, I hope they get the message. Now, hopefully cap and trade will not get through the Senate. But that said, it's going to come back and it's going to come back. And so we, in our district, in our state, have to be extremely aware of that. And I just want you to know that I think we're on the same page on that issue. But if somebody wants to bring up a question regarding cap and tax or cap and trade, I'd love to take that question. And lastly, by the way, I'm not sure, but I think there's a health care bill before Congress. And everybody wants reform. But people want reform that doesn't expand government, potentially raise taxes, and deny people care. Now, that said, there are people in this room who are uninsured. Maybe some of you have been my patients at OK Long, where I've worked for the last 20 years. Before I go further, I want to introduce a woman. Pat, will you stand? About 10 years ago, Pat? 10 years ago, a group of dentists and physicians in the greater Baton Rouge area, cooperating with the hospitals, came up with something called the Greater Baton Rouge Community Clinic. And in the Greater Baton Rouge Community Clinic, if you're working full-time, at least 30 hours a week for 40 of the last 52, do I have that right? You can get free dental and health care. Now, this is if you're working, if you're so-called the working poor. Not that you're necessarily poor, but you earn too much to qualify for Medicaid, but you don't earn enough to be able to afford insurance. And Pat, I was privileged to be on that board, and still am on the board, although Pat's trying to kick me off. Pat has screening programs in this building, in City Hall. And if you're uninsured and you're working to make a living, you can go to one of these screenings, you're given a card, you'll take it to your dentist or physician, and she or he is going to take care of you. If you need a test, you'll take it to the hospital, and just like an insurance card, they're going to donate that service. If you come see me at OK Long because you need surgery, we're going to get you right in. You don't have to go through the emergency room. And then that record will be kicked back to your physician. Several physicians and dentists in this area are on that. Jim Taylor is one of our physicians. I don't know if Jim is here. Jim's in the back raising his hands. Jim is on our board as well as other physicians from this community. So I just want to take the opportunity to say that if you're uninsured, you meet those criteria, you need dental or health care, you come meet Pat on one of those times. She's going to be here afterwards and we'll have flyers to distribute to you. Now let's talk about what's before Congress. We all agree there has to be reform. There are people in this room who are uninsured that need to have adequate coverage. The question is, how do you get there? Now, the President has taken, and the Democratic Congress, and by the way, I'm a Republican. Some of you are Republicans, some of you are independents, and some of you are Democrats. And that's okay with me. And I'm here to represent each one of you. And when I say Republicans and Democrats, I'm not being partisan because I don't care who you are. I'm here to represent you. But in Washington, it is a far different story. In Washington, you're a D or an R. It's skins versus shirts, okay? And so I don't want to offend anybody, so let me just say up front, I don't care what you are. It is my job to represent you. I am your hired help, and if I don't represent you well, shame on me. But on the other hand,